So, this is the life of a medical assistant student. I am in MA school, an accelerated 10-month program. And yes, when they say accelerated, it definitely is accelerated. Now, this class I haven't done yet, haven't started. So, this class, insurance, law and ethics, that'll be next term. I'm in my second term right now. We've already done medical terminology. And guess what, ladies and gents? Definitely passed that. But these are all the books, and I'm going to show y'all. So, medical term. Um, this is what's going on with medical term. Okay? Now, you need to know all of this type of stuff because I'm telling you something. It gets real tricky. Okay? Anatomy and physiology. This is the workbook. But this is the textbook. So you have two for anatomy and physiology. Now, these are good to use. We use Cengage, the program Cengage, which is, I guess, very popular or whatnot. But it's good to use your textbooks with your workbook because, especially for anatomy and physiology. Now, a lot of people has been having problems with anatomy and physiology. They say it's the hardest class or whatnot. But to be honest, for me, I passed it. I passed anatomy and physiology with an A. And my thing is, because I was interested in some of the things that anatomy and physiology got going on. But yeah, as an MA student, this is mostly what you will be learning. Now, here's another one, pharmacology. That's the class I'm in now. We got to learn 100 drugs within 10 weeks. So our teacher gives us 10 drugs to learn and to go over every week. So every week that we come into school, into class, it's 10 new drugs. And, let me tell you, baby. The drugs is easy. When I say you need to practice, and read your stuff, please do that. When you're in an accelerated class, it is hard. It is too much going on. You cannot get all of this information in within, 10 weeks time. So you really need to learn your stuff. And if you have some time, please take your time and study. Please do that because it gets tough, especially if you're in an accelerated class. It will break down the medications for you. It will let you know the indication for it, what it's for, side effects, the generic name, the brand name. Listen, practice and study as much as possible. Literally. Human diseases. We are in human diseases class right now, which is also called pathophysiology. Now, pathophysiology / human diseases, very interesting class because I like to know about the different viruses and diseases that goes on out there, and we deal with this stuff on a regular basis, correct? As you can see, I have my paperclip there. I've been reading some of it for the last few days. I need to read the rest of chapter 8 because we are in 7 and 8. So I'm going back. That's 8, which is the cardiovascular system, diseases and disorders. And we're in 7 and 8. So I read 7 yesterday. I'm going to read 8 today. But I am so interested in human diseases because these are the things that we deal with on a regular basis. Want to know how the body works. It gives you the description, the etiology, symptoms, diagnosis, treatment, and prevention. So this lets you know what we deal with on a regular with different types of diseases. And final book. Now, as you can see, look how thick this book is. Look at this. Ooh, this is overall the book for medical assistant course. This book, like I just showed you, is super duper thick. Now, this is for medical administration and clinicals. As you can see, administration and clinicals. So we are in clinicals right now, but I don't have a book for it. We don't, because it's mostly hands-on. So they're teaching us basic vitals and stuff like that. I have my paper clip right here because we just got out of chapter 5. This is for communication skills. Shows you how to actively listen to patients, pay attention to them when you are charting their information for the doctor. So, yeah, this is very interesting as well, because when you bring a patient into if they come into the clinic or to the triage or whatnot, you have to weigh them, which is get their vitals, all of their vitals, blood pressure, weigh, and all of that. And you have to log all that stuff into your computer or laptop before you go get the doctor, because we are the ones who go back and go get the doctor once we bring the patient into the room. Okay, now this is very interesting as well. So yeah, of course, like I said, look how thick this book is. It goes over two different, it's 2 different books in this book. Like I said, administration and clinicals. So like I said, study, study, study as much as you can, because listen, it goes down like that. It definitely goes down like that. And you want to be the best at what you do. So take it very seriously. I tell people, take it seriously. Now, if you are in an accelerated class like I am, it's a lot going on. I'm there for 2 days, okay? I'm there for 2 days a week, Monday and Tuesday, 8 to 5. And every day that I come in, we have a test in each class. So on Monday, I have 2 classes. Tuesday, I have 2 classes. So within 2 days, we're taking 4 tests. So we got to cram all this information in our head within 2 days, and you got to know your stuff. And you have to make a certain percentage in order to pass the class. So what am I saying? Study, study, study. Get your study group, study partner, or whatever you have to do to make sure that you get this information in so that you can pass the course and you can be the best at what you are going to school for. Okay? So other than that, I'll see y'all next time. And if y'all have any questions, put it in the comment section. Please make sure you subscribe and like this video. And let's go ahead and just do the best that we can so we can be the best MAs out there. Now, what I was told by my teachers, the difference between MA and LPN, because I originally went for LPN. LPN is licensed practical nurse. You are literally, okay, stuck in the nursing department. But with the MA, you have a variety of different things that you could do under that umbrella. And we'll talk about that on another video. So I'm kind of glad I got into the MA program, because I don't have to be stuck with just one thing that I can do. But if y'all want to know, make sure you tune in for that video, and I'll give y'all the information concerning that. Until then, I'll see y'all later. Have a blessed day.